Next, Matthew Stell spoke with LISD's physician about what's going on there. And Matthew, he says kids are safer there in the schools.
Yes, he does, Brian, even though many believe the numbers don't exactly reflect that right now. And he says as long as our kids stay masked up, they should be okay, but parents should always have their eyes open for anything.
That school has made every effort to determine that your child was in direct contact with somebody who could potentially has it or does have COVID.
So far, that's been the reality for some families of students at 9 Lubbock ISD campuses: Estacado and Coronado High Schools, Cavazos Middle School, Wester, Smith, Hodges, and Roscoe Wilson Elementaries, along with Guadalupe and Honey Elementary Schools. Local pediatrician Dr. Douglas Klepper says if your child's been exposed, first thing is make sure they're quarantined.
Going in and getting screened right away is probably not the best thing for your child right away. You want to go ahead and see if your child develops any symptoms over the next 3 to 5 days.
Symptoms like a high fever, heavy fatigue, sore throat, and even a persistent cough.
When you get all these other symptoms, what is COVID? What is a cold? What is an allergy? That's where you're going to have the professionals kind of help you out with this.
But Klepper says there are a few myths when it comes to the virus, especially on the topic of transmission between children.
Literature clearly shows that we are more likely to get COVID as a child from our parents than we are from our fellow students. We quickly know that the spread of the COVID for kids is much less harmful to them than the spread of the flu is. So the fear of sending them to school and potentially carrying that on to each other's children is not the point. It's about who they're going back to the house to.
Leading him to believe that being in school is probably better than being anywhere else.
I do not believe that we are putting our children at undue risk by putting them in a classroom unless there are other mitigating factors that your healthcare provider can help you sort through.
Now, we haven't received an update from Friendship or Cooper school districts, but on September 1st, all school districts will be required to report any exposures to the state. Right?
Matthew, thank you.